So we have created a web application for prototype for real-time hospital blood bank coordination platform. So we have created this web application in which I will explain each and every part of this project. We have made this under Airavata Technologies, and let's start. So here you can first see the hospital dashboard. In this dashboard, you can see all the active requests, or the requests that are delivered today, and the pending payments and emergency requests. So emergency requests are the requests that are most needed and everything. So you will have all the notification for it. Recent requests. So recently, the requests that have been accepted or rejected, all the information will be shown here. Quick action, we can opt for new blood requests. We can track the delivery of those requests, and we will also have payment history for all the requests and everything. We will also have live updates about all the requests that are going from hospitals to blood banks, and all the information, like if the requests are rejected or accepted. Also for new blood requests, you can see here, there is blood group. You can select the blood group you want to request. You can select the quantity, how much you want, and then urgency level. You can set the urgency level. If you want it as soon as possible, you can set it to emergency, or if you need it like after few hours, you can go to priority or standard according to your needs. Then you can also enter the patient name, patient ID, and special instruction if you need the delivery guy to follow some special instructions. After that, we have active requests. In active requests, we will monitor all the current blood requests. So you will have emergency blood requests, the routine blood requests, and here it will show the status of the delivery. So here you can see it was sent, then the request was accepted, and then it was picked up, and now it is in transit. So it has not been delivered here, so it will show like it is still in transit. If it is delivered, it will show delivered, like here you can see. It will also show how much units were requested, and how much time ago it was like how it was accepted. Response is received one, here you can see. Then we have live tracking. In live tracking, we will track the request from the sender to the receiver, from hospitals to blood banks. Here you can also see the delivery status: request accepted, delivered, assigned, blood picked up, in transit. In transit means it is delivering, and when once it's delivered, it will complete the request. Here you will have driver details. The one who is delivering the blood will have all the information about him. Like here you can see his name, contact, rating, everything. We'll also add an option to call the driver. Then we'll also have request details. So request ID, blood group, quantity, patient, and priority, and so on. So then we have the payment portal. Here we will set up the payment portal according to the request, and how much units were ordered and everything. This all is the hospitals section. Now we'll move on to the blood bank. So in the blood bank, here you can see the blood bank dashboard. Here you can see the total inventory of that blood bank, specific blood bank, and then you can see the pending request. Here you will see the pending request numbers and the active deliveries. The requests that are being delivered now, you can see those in numbers, and the total revenue that is generated. Here in the blood inventory, you can see uh, each and every blood type and the units remaining in the blood bank. So if the blood bank is low on some units, it will get a notification, like an emergency notification, that they are low in stock and everything. Then we have incoming requests. So the requests that are not accepted, but are arrived to the blood bank will appear here. Here you can accept the request, decline, and here it will also show that the urgency of the request. So it can be like here, like I shown the urgency level, emergency, priority, or standard. Depending on that, you will receive the urgency messages. So here you can accept the requests of those who are more urgent than those requests who are more urgent than other requests. Then here you have incoming requests. So here you can see which hospital has sent the request, the request ID, the patient who needs it, how much how much distance the hospital is from the blood bank, and how much time ago it was sent. Here you have all the details that which blood is needed, how much quantity, and the patient ID. In blood inventory, you will have the blood inventory in more detailed way. So you can see how much each blood unit is in stock. So if it's low in stock, it will show low. If it's very low in stock, it will show critical. And if there is like good amount of unit, it will show like status as good. So here you can also see how much units are there remaining. So if they run out of stock, here you can see they can also add stock. Then there is low stock alerts and usage reports. In usage reports, you will all have all the analytical data and graphs and everything. And then in driver management, here you will have all the data related to the driver who is uh, delivering all the blood requests from blood banks to hospitals. Then we have a driver dashboard. In driver dashboard, you can see today how much amount of deliveries were there, active assignments, rating, then the earnings, then current assignment. So here you can see the drivers that are currently assigned, and all the information will be shown here. The driver profile, the information about the driver will be showed here. Recent deliveries. So here you can see all the previous deliveries. Here you can see the navigation part, GPS navigation and route optimization. The GPS navigation, integrated navigation system, is coming soon. So we have add all the GPS navigation part here, right here. So you can track the driver when he's delivering the blood. Here we have the admin web portal. Here we will have the admin dashboard, and here we can add new hospitals, register blood banks, and onboard like new drivers. So all the drivers that will be working will be verified and everything. Here you can see the active number of hospital blood banks that are included in this system, and number of active drivers, and the monthly revenue. Here we have all the different types of details, and also the system alerts will be handled from here. Active users, system activity logs. So we will have all the analytical data also needed for us. Here you can see the notifications, and here you can see the user account. So that will be all about this software. Also we have an analytical part, where we will display all the analytical data. Here you can see average response time, success rate, emergency response. So here the data about the web application will be shown, that how it is performing and everything. The blood type distribution, which blood is more in demand, and which blood is less in demand. Top hospitals by activity. So here we will rate all the hospitals who have who are using this portal and successfully. System health status, we'll have all the data, real-time system monitoring. So according to the usage of a web application, the data will be updated here, and we will be more informed about this about it, so we can improve our software, improve our web application, and make like good changes to it. So this will be all about our web application. Thank you.